We were baling hay with my daughter, putting hay in a barn before the storm had come. I stepped down, and as I stepped down, my feet slipped on hay chaff. I went up in the air, came back down on my back. I have worked in the EMS background. I knew I was seriously hurt and I couldn't get up and I couldn't move. So they got the local ambulance, county ambulance. They came. They were unable to provide what I needed at that point, so then they ended up calling LifeNet. They were able to get my pain under control a little bit so that they could transport me. They then transported me by ambulance to the landing zone, and then from the landing zone I ended up at Albany Med.
Yeah, so LifeNet in New York, we have a pretty big footprint in the state of New York in particular, about 12 bases over the entire state, strategically located to serve some of the more underserved communities in the area, ones that are long distance from hospitals, may or may not have some reliable 911 services to them.
Landing at dawn at scene, there was already a Schoharie County EMS on scene. We got report from those providers. So I think the biggest fundamental thing is when we land at scenes, especially for 911 and such like that, care has already started. So landed on scene, got report from them, but the biggest goal for us was to make Donna comfortable and to get her safely to the aircraft so we could get her transported to Albany Med for the higher level of trauma services that she needed.
Albany Med draws patients from all over northern New York as well as western Vermont and western Massachusetts. A partner like LifeNet is really critical for us in terms of bringing these very sick patients to our tertiary care center where we can provide them the care that they need. Air Methods and LifeNet have been huge in terms of being able to bring that level of care to our rural communities as well as to our smaller hospitals. They've also provided a fantastic framework for us to learn and help guide and develop ground systems of care that can provide additional patient care on days when LifeNet can't fly.
So mainly because of where we're located geographically. We have one hospital in Montgomery County and it's not a trauma center. So anytime we have a trauma incident or a burn incident or something like that, and they need that extra care, it gets them there much quicker, gets them to those necessary emergency services compared to driving them by ambulance would take hours. LifeNet of New York can come to us, load the patient, give them better care, and get them there much quicker.
I did get the bill from LifeNet. I ended up calling LifeNet and I said, hey, I need some help here. They in turn took over with my insurance company and took care of it, and it was such a relief to have such a good crew to work with. LifeNet took care of everything for me and I had nothing to worry about after that point.
Every patient transported by LifeNet of New York is assigned a patient advocate to help them through the post-transport billing process. These advocates help with reducing the confusion around medical billing and assist in managing the insurance claim. We work to reduce our patients' out-of-pocket costs while the patient and their family recover.